Dr Alan Currie is a UK-based clinical psychiatrist who specialises in sport. He's a member of both the IOC's Mental Health Working Group and of the Mental Health Working Group launched by the IBU and BIU earlier this year. I'm Callum Murray, and in this podcast interview I speak to Dr Currie about how and why athletes and their support staff develop mental health concerns and what help is available to them. Stay tuned.
My interest in the mental health aspects of sport predates my training in psychiatry. I was aware as an athlete in very much on the fringes of high performance sport for a few years in my late teens and early 20s that there were issues. There was an oddness around some of the things that athletes were experiencing that people weren't really looking into. People who were becoming really quite miserable and unhappy in their sport and getting stuck in it. Eating problems were a concern. I was an endurance athlete and I saw that around me. So I had an awareness that there was things happening in the mental health space in sport even before I trained to be a psychiatrist. And halfway through my training in psychiatry, we get the opportunity to do some research. And I thought, well, I'm still kind of involved on the fringes of high performance sport. It'd be interesting to do to research this. So I did a piece of research, a survey of endurance athletes for my master's thesis, which I really enjoyed doing. And that introduces me into being a clinician, being a mental health clinician in high performance sport. But the opportunities were small. I mean, the sports teams didn't really see the need to have a mental health clinician at all, far less a psychiatrist. So I did a few projects here and there. Alongside my NHS work, I was full-time in the NHS. So I did some consultancy work here and there and a few bits around the fringes. And it really started to take off about 15 years ago when we started running some educational sessions for other psychiatrists who were seeing athletes and who were, interested in the unusual context in which you have to support athletes with mental health concerns. And so we ran a few projects, some educational sessions, and then we set up a group of sports psychiatrists in the UK in 2016. And then in 2019, two important things happened for me that just took me even further into the mental health space in sport. One was joining the IOC's mental health group, and the other was being appointed to the UK Sport Institute to advise on mental health matters and to offer support to athletes in the system.
It's interesting you mentioned eating disorders in endurance sport. What was your sport?
I was a runner. I was a miler, a 1500-meter runner, in the early 80s.
And eating disorders do seem to be a growing problem in endurance sport.
I'm not sure it's growing. I think maybe the awareness grows. The awareness certainly grew a fair bit through the 80s into the 90s and into the noughties. I was aware of it in the early 80s when I was running, and aware of people around me who clearly had some difficulties. So the awareness has grown. I'm not sure there's much evidence that the prevalence is any greater. And we know a bit more about it, and we know a bit more about how to assess, diagnose, treat, how to help athletes who are in difficulty with eating disorders. And also how to separate those who are clearly in difficulty with an eating disorder from those who maybe have, who may be struggling to fuel for other reasons or who are underperforming because of energy availability issues, but who don't have an eating disorder. We're a bit more sophisticated about that now, but I don't think the prevalence has gone up.
You've published case studies in sports psychiatry. What distinguishes them from other non-sports related cases?
A few things. The context, really, the environment in which athletes are trying to thrive. But the similarities to non-sport are something that I constantly emphasize. Athletes are people. They're individuals, they do unusual things, but they're people. And a lot of the mental health concerns that we see are actually the same as non-athletes. And often the things that contribute to them are the same as non-athletes. Maybe there's a family history, maybe there's a genetic element, maybe there's particular problems in someone's life outside of sport, financial problems, relationship problems, a family member who's ill. The usual difficulties that can be a prelude to a mental health concern emerging. So often we're emphasizing the similarities, and it's not about the sport. It's happened in sport, but not because of sport. But there are some particular challenges that athletes face. They're constantly measured and monitored, for example. I get assessed once a year on my performance, but not twice a week and not on the back pages of all the newspapers or on. I don't get trolled in social media. And the other ones, the big injuries. Injuries are catastrophic. You know, a little niggle for me, a bad back for a couple of weeks, not really an issue, but for an athlete that can be catastrophic. And then they have to transition. They have to transition into high performance sport when they're in their late teens and early 20s, and they have to leave it early. I'm approaching retirement now. I've had a long and very happy career in psychiatry and in medicine. But for athletes, sometimes that ends, sometimes really quite suddenly, unexpectedly, out of their control, and very early. And they have to transition into a life outside of sport. And that's a difficult one. So there are some sport specific issues, but oftentimes it's the commonality that we see with others. Athletes are people.
And leading on from that, why might athletes develop mental health concerns? But, what are the risks?
The big risks seem to be issues around performance challenges, performance concerns, or more appropriately, the perception of performance. The idea that first and seconds nowhere is can be helpful up to a point, but you're never going to win everything. And if you're really hard on yourself and you're a very driven individual, then that combination of setting high standards and beating yourself up if you don't meet them can be a significant challenge for athletes. The biggies tend to be things like injuries and transitions, and especially when those two are combined. When you have to make a sudden transition out of something that you love or that's given you an enormous amount of positives, and you have to do that suddenly, and you're in pain when you're doing it. Your contract gets terminated, you lose your place in the team. And there's often a domino effect as well. An injury can cost you your place in the team, which costs you your money, which costs you your relationships and all the rewards that you get from sport. And so there's sometimes a domino effect for athletes as well. You know, one thing leads to another, if you like.
So, what kind of concerns are presented? What kind of mental health concerns? What's the range of symptoms and conditions that you're seeing?
All of them. uh, Everything from fairly minor, let's say minor, maybe some issues around stress and anxiety and not sleeping very well and insomnia, all the way through to some of the more severe and challenging mental health conditions like psychosis, bipolar disorder, even schizophrenia. So the absolute entire range. But the biggies and the ones that we know most about would be depression, anxiety, substance use problems, including alcohol and eating disorders.
What help is needed for athletes with mental health concerns, and who should provide it?
The whole range. I mean, I meant a successful mental health strategy for a sport or for an organization or for a team. It has to include something at the preventative end. So, what's the right environment to allow athletes to thrive? How do we pick up on problems early? How do we identify the athletes? So maybe just in the early stages of starting to run into problems, and if we can do something about it, then we get better outcomes. What about access to the right sort of specialists, to the right therapists, to the right clinicians? Medication, if it's required, as it sometimes is, that's a challenge to prescribe for athletes. And then support to recover and to return to play. So the whole spectrum from prevention, screening, early detection, good access to high quality mental health care if it's needed, and support to return to play. So what athletes need covers that whole range. And that would include things like helping them to be more literate about their mental health, to take it seriously, to be able to, where possible, to self-manage their own mental health. But when they're running into difficulty, to know who to approach, who to get support from, and how to get access to treatment if it's required.
And whose responsibility is it to provide that help?
It's everyone's business. The responsibility belongs to all of us. Athletes have some responsibility to look after themselves. Sports teams and organisations have responsibility to take mental health seriously in the work environment and to create environments where athletes will thrive. Not just a responsibility to do that, but a significant benefit from doing that as well. Because if you look after athletes' mental health, You're not just exercising your duty of care, you're protecting your investment. If you look after athletes' mental health as a performance director, team manager, team doctor, then you might get 2 or 3 Olympic cycles out of your athlete instead of just 1 or 2. You might get 15 seasons instead of 6 if you're in a sports team. So it's everyone's responsibility. Clinicians like myself have a responsibility to make themselves available in the sporting space because if athletes have significant mental health needs, they should see an expert. They should be able to see the best. Every athlete, and even recreational athletes, know who the best physiotherapist is in the locality. But if you ask them where's the best clinical psychologist, psychotherapist, or psychiatrist, they don't always know that. And we have a responsibility to make ourselves available.
You're a member of the IBU and BIU's mental health working group. What's their role in this field?
I think the first thing that they did that I really liked was they took a step back and said, what do we need to do? Mapping out what's already there, what's already good practice, where are the gaps? How can we start to fill in the gaps? Do we know where the best clinicians are if athletes need them? What's our strategy for building mental health literacy? What's our strategy for supporting athletes at key points, at big events? What's our strategy for supporting athletes in kind of dual career type activities? So helping them to still get an education that will allow them to move on after sport and into a life beyond sport. So kind of mapping the terrain, looking for the gaps, identifying the experts who might help them to take that bird's eye view and help them to try and fill those gaps. And another important thing that they've done is that they've looked beyond biathlon into other sports and looked at other sports and what's going on there. What can we learn from what other people have tried? What can we learn from what another organisation has done? Is there some work already done out there that we can adapt for our context? And it's surprising how much commonality there is from one sport to another. There are important differences, individual sports, team sports, summer sports, winter sports, contact sports, collision sports, endurance sports, hand-eye coordination sports, target sports, ball sports. There are differences, but there are important commonalities and sports can learn from each other.
Yeah, that's interesting. Are there any particularly good role models you think for the IBU's mental health working group?
Interestingly, I'm finding that what the IBU is doing is things that other sports could copy. I'm very positive about the initiatives that they've taken and how they're going about it, and I think other sports would do well to do something similar. The IOC have made some stuff available across all sports. The screening tools that were developed by the IOC, the mental health toolkit that looks at a very, very broad and comprehensive strategy for addressing mental health concerns, some of the educational materials that have been produced. World Aquatics have done quite a bit on education. The UK Sport Institute, where I work, across all sports in the high performance system, has built up a therapy network, makes experts available to sports medicine doctors, physiotherapists, sports psychologists who want to discuss an athlete that they might be worried about. And some sports as well have gone the extra mile and are now making the mental health services available to the entourage, the athlete support teams. And that's an incredibly useful thing to do. And some organisations are already going quite far with that. UK Sport Institute would be an example of that. And then in Australia too. If you look after the coaches and the physiotherapists, then you're actually looking after indirectly a lot of athletes.
And last question, what general advice would you give for athletes or coaches or other support staff who are suffering mental health challenges?
Know yourself. Be aware of that mental health doesn't exclude anyone. Mental health challenges can hit anyone, and be prepared to acknowledge that. So know what could happen, and take steps to look after yourself. Take mental health seriously. Athletes take physical health seriously, don't they? They look after their physical health. They wash their hands, they don't touch door handles, they eat well, they try to sleep well, they moderate their drinking habits. Their body is a temple. And looking after your mind in the same way is a really important thing for athletes to do. So at least acknowledge that it's worth doing, and know what to look for, and look hard, and know who to turn to. Who would you go to? Who's your confidant? Who would you confide in? Who are your supporters? And then there's other soft things that people can do. Stay connected. have people around you. Social supports are an incredibly important thing for us all, and for athletes. And then know where the experts are. I gave the example earlier of knowing where the best physiotherapist is. Every sports person that I know will tell you who the best physiotherapist is within a 50-mile radius. So know where you'll get your mental health support if you need it too, in the same way that you would know where to get help with an injury.
Thank you, Alan. Really great advice and really useful overview of the situation. Thank you very much indeed.
You're welcome. Pleasure to talk to you.